If you have a hospital stay or a loved one does, and you want to get the best care that you can and come out of there alive, then you need to hear these things that I need to share with you. Stay tuned. Hi, and welcome to my channel. Thank you so much for being here today. Well, today I have a little bit of a rant, not really a rant, but some good information that I felt was extremely important to share with all of you. And this involves being in the hospital. Now, because of my recent experience with my brother-in-law, Ken, who was in the hospital for 29 days, I saw a lot and I learned a lot, and some of it is just disgusting as far as I'm concerned, very disappointing. Now, I think many of us may know that the healthcare system has changed drastically. I'd say in the last maybe 15 years or so, and the whole system is just decayed and continues to decay. It's not how it used to be. Hospitals used to care about their patients, and they would provide the best care that they could. Doctors felt that way, nurses, all the staff, they were working to get you well, and that was their top priority, as it should be. It's not like that anymore. Everything has changed. It's all about money, and it's all about the numbers. They want to charge you more, but give you less. Hospitals are now run by big corporations. So it's big business, just like any other business. And the business is about money, not your best interest, not caring for patients. Now, I can't blame it on all the doctors and nurses and everything. They've lost their autonomy. They have to follow this protocol and just do what the hospitals tell them. They are short-staffed. Nurses work very long shifts. They don't have enough nurses. They are stretched so thin that you get subpar care. And from what I saw and experienced, I pray I never have to go in a hospital. The best thing you can do for yourself is try to keep yourself out of a hospital. They just don't have time for you because there may be one nurse that could be assigned to 5 or 6 critically ill patients, and they're all needing things. Well, you can push that call button all day long, but they're not going to get there quickly. Things fall through the cracks. The communications between the staff, the nurses, from one nurse to the other when they change shifts, and to the doctors just isn't happening. Nobody has time for it. When the doctor comes in the room, he zips in and zips out. You don't have time to ask a question, and he doesn't have time to answer it. They just show their face and walk back out. If you need something, say you had to go to the bathroom, and you hit that call button and nobody shows up. They might in 15 or 20 minutes, but that might be too late for you. You cannot be sure that the patient is being taken care of. You have to be an advocate. You need an advocate with the patient at all times, whether you're the patient or your loved one is. I know it's difficult because you spend long hours. You're at the hospital for 10, 12, 15 hours a day because you have to be to advocate for the patient. So if you have family members, anybody that can help out, that can maybe take a shift for you or come in for a couple hours to give you a break, that would be wonderful. But I would not leave my loved one alone in a hospital. Now, I know you can't stay overnight, not when you're in critical condition and in ICU, but you can be there all day long from morning until night, and that needs to happen. There's so much incompetence, and it's not because they're bad people. There are good nurses and good doctors, but they can only do so much. They can only carry so much of a load, and they are so overworked and overburdened that they just can't do the job that they may want to do. Hospitals now are all about the bottom line, as I said, money, and patients are getting short-changed. Dave and I were there for 29 days because Ken was in there in the ICU for 29 days. And we saw so much. Your loved one may tell you that they're in pain and they need something or something is hurting. And so you hit the call button, nobody shows up. You go out to the nurse's station and tell them, and they say, okay, we'll get some pain medication. 20 minutes go by and nobody shows up. That's how it is. And it's not just this hospital. He was in Savannah in the hospital. It could be many hospitals. I believe it to be most hospitals because healthcare is just not the same anymore. So my number one point that I want to stress is make sure you have an advocate if you're the one in the hospital or your loved one has an advocate at all times. It's sad to say that, but it's true. There were some good nurses. There were some great nurses. You know how some people just go above and beyond and really stand out? And we were very fortunate to have some nurses like that. And then the rest of them were good. I mean, they were really good. They weren't negligent or nasty or anything like that. But we saw a lot of nurses in those 29 days because, of course, they change shifts and different people come on, and we got to see a lot. And we were fortunate in many ways, but there was one, just one, but a really kind of nasty nurse. And boy, I'll tell you what, I really blew a gasket on that one. I truly did. Because Ken was not allowed to eat or drink. He couldn't even have a drop of water on a dropper. You know, just a little dropper thing. Wasn't allowed because he can't swallow. Well, he couldn't swallow at the time, the whole time he was in the hospital. With all the problems he had, 9 broken ribs, a broken shoulder, a part of his lung had to be removed, a head injury, a brain bleed, on and on and on. Every day he would try to mutter the words, please, please, let me have something. I am so dry. I can't take it. And he was. He had a hard time forming words because his mouth was so dry. His tongue was stuck to the roof of his mouth, as you could imagine. And of course, I understood why he couldn't have anything. Well, then for a few days, we had these different nurses, and I said, can't you do anything? to just relieve the discomfort of the dry mouth. You could tell it was stuck together. His lips were stuck together. They were crusty. He was just miserable. And they said, well, one thing you can do is moisten the inside of his mouth. Well, first I'm thinking, well, why haven't you been doing that? And they're not, unless you keep bringing it up. Isn't there something? What can you do? Find a workaround, do something. So they gave me one of these. It's a stick with a sponge on the end. You dip it in a glass of water and then shake it off. And again, it's a sponge, so now it's just a little moist. And you can put it inside their mouth and twirl it around and just kind of moisten the inside of their mouth and their lips. And so they gave me these to use. Well, again, these weren't in the room. I had to beg, can't you do something? There's got to be something. And this is what they gave me. Well, at least that was a little relief for a few minutes. And then it had to be swabbed again and throughout the day. That was no problem. Dave and I were there and we did it. Well, one day this one nurse was working and I hadn't seen her before. And I was in the room with Ken, so was Dave, and I was doing that, swabbing his lips and the inside of his mouth. And she came in and said, "You're not allowed to do that. You can't do that." And I said, "I was given this by another nurse, and I've been doing it for 2 or 3 days." "Well, I don't work that way. This is my patient," she said, "and I'm not going to lose my license because of you." And I'm thinking, what is your problem, lady? So she's going off and saying all this stuff. And I said, the only way you're going to lose your license is because of your nasty attitude and the no compassion and respect you have for these sick patients. So then she comes back in and says, "I'm going to call security." Okay. Well, I told her, go ahead. I've already called the director of nursing and he's on his way up here right now. And right then he showed up. So he talked to me, he apologized for her behavior, and he said she will not be on Ken's case anymore. She would never be scheduled to treat him and be his nurse for a shift, which I was very grateful for. So that's the only bad nurse experience I had, but it was pretty bad. I had one other situation where every patient has a case manager. And so the case manager, I was talking to her and I said, when Ken gets released, I want him to go to Encompass Rehab Hospital. And she said, well, we don't need to talk about that now. And I said, well, I need to talk about it because that's where I want him to go. And she said, well, he really should go to a nursing home. Huh, over my dead body. That really, really made me mad. So 2 days later, when I get there, in the room is a couple pieces of paper stapled together, and it was a list of 12 nursing homes that I could contact. So when Ken would get released, he could go there. Okay, that did it. I blew a gasket big time. So what did I do? I'm not going to put up with that, and you shouldn't either. I called the director of the case managers. I explained it all to her. I told her in no uncertain terms, he will not go to a nursing home. He will go to Encompass Rehab Hospital and then he will come here to convalesce until he can get on his feet. No nursing home. So she gave me a new case manager. and he got to go to Encompass Rehab Hospital. But do you see what I'm saying? You have to fight for everything. It shouldn't be that way. You want the best care if you're the patient, or you want the best for your loved one. You shouldn't have to fight for these things. You do have rights, and they don't want you to know that, but you do. You don't have to do everything they say. Another point I want to make is find out every medication they are giving the patient. Find out the name of it, the dosage, why they're giving it, and then research it. And then go to your pharmacist and see if any of them interact negatively with some of the other drugs that they're taking. Get this information. They follow a protocol. An example would be like, say, everybody over 65, they're going to put on a cholesterol drug or a blood pressure drug. Well, everybody over 65 may not need that, but they follow a protocol and they don't deviate because they don't have the freedom anymore to think on their own, to say, I don't think this patient needs this. No, they got to dish them all out because it's money, money, money. Well, you have the right to say, no, I am not taking that, or my loved one is not taking that. I want them off that medication. I don't approve of it. If they want to do certain procedures, now in Ken's case, he needed everything he got. He had to have CAT scans regularly, daily, and MRIs and X-rays and all the things he had. He had to have part of his lung removed because he was bleeding internally from damage to the lung from the accident. But in other people's cases, they may want to do a certain procedure. If you don't think it's right or that your loved one needs it, say no. You have the right to do that. When you're getting ready to get out of the hospital and they say, okay, I want you to have a follow-up appointment with this doctor, he's a heart doctor, or this doctor, he's an orthopedic, or whatever the case may be. Yes, you want follow-up appointments, but you pick the doctor you want to go to. You don't have to go to the one they refer you to, which is going to be part of that whole hospital system. Could be their golf buddy, one of their friends. That may not be the best doctor or the right doctors for you. So you decide, do your own research and call and make an appointment with the top rated orthopedic or cardiologist or whatever it may be. Do not let them dictate to you what has to be done. Also, you can request a change in your care team. In other words, if you don't feel like you or the patient, your loved one, is getting good care, or that the nurse is not compassionate or responsive, or the doctor isn't, you can request different healthcare providers. You can say, I don't want them treating my loved one. That's not the doctor I want. I don't communicate with him. He's not responsive and I'm not satisfied. And the same with the nurses. You have the right to do that and they will do it. So don't put up with anyone that you feel is giving subpar care to yourself or your loved one. Now, I don't mean this video to be downing nurses or doctors, because where would we be without them? I mean, sometimes you really need them, but you deserve the best and you shouldn't settle for less. Be positive, say please and thank you, but ask your questions every day and document everything. If the nurse comes in and you say, my loved one, is complaining of pain somewhere in his body, can you give him some pain medicine? And she says, yes, I'll go get it. And 20 minutes later, she's not back. You get out there and look in the hallway, go to the nurse's station, or hit the call button 10 times if you have to, and say, hey, you said you were bringing pain medication in 20 minutes ago and it still isn't here. My loved one is suffering, so please get the medication. So be kind, but you have to be sort of demanding. I mean, you have to stay on top of everything they do. It's not their fault. They're stretched too thin. They're pulled in so many different directions. So I'm not faulting them, but in the hospital, you're there for good care, and that's what you deserve. You have to fight for it. If things don't seem to be getting resolved, you can request the bioethics committee to get involved, and they work fast. They will be on that very quickly. I know that may sound extreme, but sometimes you may have to do that. I didn't have to do that, but I would have if I would have done it if I needed to. So the bottom line is everything is so different. Be prepared, be equipped, make sure you have an advocate with that patient or with yourself at all times, or you may not make it out of there in the condition you should make it out of there in. Well, this video is getting long and I don't want it to be too long, but I have more to say. So I'll call this part 1 and I will film part 2 right after I do this video. I'll have the same clothes on and everything, and I'll put that up on Tuesday. So let me go ahead and give you an inside beauty tip. And thank you so much for listening. My inside beauty tip comes from Psalms 9:10. And those who know your name put their trust in you. For you, O Lord, have not forsaken those who seek you. We have to have some trust in the medical system, or what are we going to do? But that's not where your main trust lies. When you're looking for a medical provider, hopefully you find one that you do trust. But don't trust them completely. Don't trust them with everything. Above all else, trust in God. That's where you need to place your trust. And it's not just because He is the great healer and the great physician, but it's because He will give you the wisdom, the knowledge through the Holy Spirit to use your own common sense, to think things through, to not buy into everything. He will give you a word of knowledge, and you'll know what direction you need to go in. You'll know if something doesn't seem right, that you're not going to let it happen. You can only pray for God to intervene. Place all your trust in Him first and foremost, and don't let anyone else have that honor of your trust like you trust in God. He's the only answer. He is the only way. And I know that from experience. I thank you so much for being here today. I truly do appreciate it, and I will be back in a few days with part two. So until we meet again, this is the old girl signing out. See ya.